In Ontario, about 2 million people continue to smoke. On average, we know that smokers attempt to quit about once per year, but only about 2% of those quit attempts are successful. In order to truly make a substantial dent in smoking prevalence, we need to increase the rate of quit attempts in our community. We know that health concerns are the #1 reason why people quit smoking. Hearing stories from former smokers about the ways that tobacco has negatively affected their lives can help motivate them to quit.
We started the Media Capacity Building Project because we saw an opportunity to work with local public health units to help them use the media to stimulate quit attempts in their own communities. Alongside policy and program approaches, the use of the media is one of the key interventions that we have in tobacco control. Published evidence has shown that testimonial-based campaigns featuring hard-hitting messages about the health consequences of smoking can increase the rate of quit attempts. This evidence comes from national and statewide campaigns. What is lacking, however, in the evidence base is the role of local media strategies.
6 projects were selected to participate in the Media Capacity Building Project, and the Program Training and Consultation Centre provided training, consultation, knowledge exchange opportunities, and a small amount of funding, which the health units matched through in-kind contributions.
So York Region Public Health saw this project as an excellent opportunity, as it was using an evidence-based approach to encourage quit attempts among adults in York Region. We had never created a local cessation campaign featuring former smokers' testimonials before. We know that stories can be a powerful tool to engage with your audience, and it was a unique approach to engage the York Region client voice.
Well, to start with, we went to our senior management team and we made sure they were on board with us, and they were absolutely right from the get-go. We then went and talked to our communications team to make sure they'd be able to support us. We knew there was going to be a lot of work there. And then we went out to our community partners and we asked them if they would support the campaign, if they had possible people who would help us. At that point, we knew we were good to go and we submitted our proposal.
When we first heard about the media project, we were in the process of developing a campaign to promote our directory of cessation services. And we thought it would be a really good fit to integrate the testimonials of former smokers into this already existing campaign.
We felt a little apprehensive at first about recruiting for the campaign, as we had never done this before, so we didn't know whether we would have 1 person or 20 come forward, and how we would narrow it down to select from the different stories, and whether or not we would have people come forward who had experienced the negative health effects of smoking.
We put a little bit of money behind ads on Facebook, and we got nearly 30 submissions within a week or 2. People really wanted to share their stories. There were applicants from all across the Northwest region, and a real variety of stories to pick from.
We were able to create a local innovative cessation campaign that we've been working on integrating into cessation services throughout York Region, and we are promoting it through our community partners, who are then promoting smoking cessation with their clients throughout York Region.
This was a really great opportunity to try something new, to do some things we'd never done before while learning some new skills, as well as connecting with community partners and really building relationships with people in our community.
We had people calling into the health unit to thank us for running the campaign. And for the people who shared their stories, in their local communities, they had people stopping them, recognizing them, saying, "I remember your story, you could quit, I'm going to try and quit too." And that was very positive for us.
The Media Project really facilitated the sharing of experiences among the project participants and provided them with a great opportunity to really learn from one another. One of the most encouraging things to come out of this project is that the campaigns themselves have actually inspired other health units in regions across the province to explore developing similar campaigns in their own communities.